Treatable disease if you can afford the treatment. Diabetics who rely on daily doses of insulin are finding themselves cash-strapped and taking extreme measures to deal with the skyrocketing cost of the medicine. They're now getting help calling attention to the problem, but finding a way to fix it is the most difficult challenge. Most of us take medications to feel better. Others take it to stay alive.
Insulin is not a choice. It is a means of life. It is like water to people with type 1 diabetes.
But unlike water, insulin does not flow freely. And the cost of the life-saving medicine for diabetics, like 28-year-old Christopher Noble, has skyrocketed. Over 20 years ago, you could buy your monthly insulin for around $25. But now,
upwards of $300 if you're buying it out of a vial. It could be as high as $500 if you're buying it in other forms. So it's multiplied by the thousands at this point.
And the cost is leading to a serious health crisis. Some patients can't afford the insulin, so they are rationing it in order to spread it out and make it last longer, not following the doctor's recommended dosage, which is dangerous and life-threatening.
Every person with type 1 diabetes that I've ever met is rationing their insulin. They are aware of how much of the insulin they have in their fridge at any one time.
No, you can't hide. Your drug prices are homicide.
This protest at Sanofi in Cambridge, one of the leading makers of insulin in the U.S., was organized by Brookline-based Right Care Alliance. The RCA is a grassroots coalition of clinicians, patients, and community leaders. They're activists and say their mission is to hold healthcare institutions like the drug companies accountable.
Almost anywhere you look, the pricing of drugs doesn't make a lot of sense except from the point of view of the people making the money.
Dr. Vikas Sani is the co-chair of the Right Care Alliance. His office proudly displays the signs used in the Sanofi protest, part of what they call public clamor to effect change.
The time for talk is over, and we need action, and people are willing, even to take to the streets in order to see that action fulfilled.
In remembrance of young people who have died because of these high price rises.
The issue has even caught the attention of Senator Elizabeth Warren. Over the weekend, she tweeted, quote, "Big Pharma is doing everything it can to keep raking in the cash on the backs of people with diabetes. We need to level the playing field for working people with life-threatening conditions who are getting crushed by the outrageous drug prices." But right now, pharmaceutical companies can do what they want.
It's not illegal for them to raise their prices.
Todd Brown is a clinical instructor and vice chair of the School of Pharmacy at Northeastern. He says everyone needs to play a role in finding a solution.
How are we going to determine how much we should pay for drugs to keep that balance of providing incentive to the drug companies, but also having drug prices that we can afford?
Now, we reached out to Sanofi for comment. In a statement to us, the drug company is urging anyone who's having trouble affording the medicine to call their patient connection hotline. Eligible patients can get the medicine they need at no cost. The company says it takes the issue seriously and continue to explore innovative ways to find solutions to help eliminate or significantly reduce the out-of-pocket expenses for patients. Now, one reason the price of insulin is high is that insulin does not have a generic version, and there does not appear to be one on the horizon.